move on and talk about gender dysphoria and the transgender sort of movement. It's big in the country right now. So tell us about kind of how, like, your interactions with it, how you kind of came to study it and all that.
Yeah. So it is a population that's just near and dear to my heart. Part of it is kind of selfish as a therapist, I think, simply because, I don't know if it's weird to call it selfish, but it is so amazing to get to see these individuals go through their transitioning process in whatever that way that means for them, and to see all these other symptoms of depression, suicidality, substance use, social anxiety, like all of these other symptoms just fade away as they become true to who they are. And so I think that that's where it's like, oh, I just love that part. Right? It makes me love what I do, to get to see them be so happy and better functioning, and because they're just being who they are. But I became introduced to working in the LGBTQIA plus population when I was at University of Iowa completing my doctorate, and we had the LGBTQ counseling clinic there that works directly with the LGBTQ clinic at Iowa River Landing for University of Iowa, and amazing clinics. They do amazing work there. And at the counseling clinic, we performed, for one, it was all free counseling, right, for anyone in the community, but especially for individuals who were any part of the LGBT population. But we also provided free it was all free counseling, but we also did free assessments for individuals who wanted to begin HRT, hormone replacement therapy, or gender affirming surgeries. And getting to work with that population, I think many of my colleagues as well, you fall in love with wanting to help these people get on their path to being their best self. But for me specifically, because a lot of my clients will ask me, like, why you? Do you have a family member? Or do you have, right? And like, why are you interested in this? And I think for me, it's my own struggle with body dysmorphia. Mm-hmm. So again, even though they're two completely different concerns, I know what it feels like to look in the mirror and see something that you don't like. Even though mine has nothing to do with my gender, like I feel great in my own gender, but the way that it's always been described for me from clients is like, imagine if you looked in the mirror and what you saw looking back at you, the man that you are, right, the very masculine man that you are, you're just crushed because it's not what you're supposed to see. You are supposed to see this female looking back at you. And or, sometimes it's not, people with gender dysphoria, it can be not that they feel like the other gender, but that there's somewhere in between, right? And so regardless of how their symptoms kind of manifest, it's helping them to figure out what does transitioning look like for them? Is transitioning what they want or need? Like maybe they're more androgynous, right? Maybe they prefer more they, them, their pronouns, and helping them to be able to be that advocate for themselves, to assert that to their family and friends. And what does that look like, right? And so exploring that path with them of what does helping them to be their best self. So that part of me that loves ambiguity kind of loves that too. Like you really get to work collaboratively with that person of what does this preferred future look like, rather than there being this direct map for every person, right?
Sure. So one of the things that I think people really struggle with is, first of all, you compared it to body dysmorphia, and we've already sort of a little bit in flavor. So what you said was it's near and dear to my heart because I had these issues and so forth.
Right.
People would say, and this is again me playing devil's advocate, Dr. Peter Daniolos, who was one of my professors at the U, he's a child psychiatrist. He does a lot of work with younger people, and I would love to get him on the show. He's very busy, and that's what he said when I asked him at one point, but at some point in the future. But I think a lot of people are skeptical. Sure. And they would say, well, we've sort of agreed in this conversation that BDD is psychopathology in a way. I mean, you're imagining your nose, your skin, your face. So then, especially with young people, isn't this just another form of psychopathology or delusion or, sort of questioning when you're young? At what ages have you sort of started working with people? At what ages do you see it manifesting? At what ages do you think it's real versus perceived? Like, what's your take on that?
I think what I would say to my first initial reaction to, for one, I completely understand when people don't have the awareness or the background or the work with these populations that they be skeptical, right? I think any and all of us have had, where we're ignorant to certain things and then we're skeptical. But I would say they don't have the understanding yet, right? They have not. And I think so much too, the personal is political, right? Like once you know someone, once you work with this population, it's like, oh my gosh, okay, I can get it now, right? So I think oftentimes there's just not experience with it, especially like if it be clinicians or physicians. So what we often see though with it, so I'll jump around a little bit.
Yeah.
What we often see is that, symptoms can manifest in childhood as young as 2 and 3 years old, right? Oh yeah. I've worked with, I don't want to name specific ages, but I've worked with children, younger than 10 years old, younger than like beginning adolescence, right? And I've worked with individuals from 3 on up to 70 years old that are struggling with gender dysphoria. And one of the things that the public should be aware of, or that, people who are struggling with this should be aware of, like in children, what can happen is, and this is found in WPATH standards of care as well, is that oftentimes before adolescence, if there's gender dysphoria, more times than not, those children begin to feel more and more comfortable in their own skin.
Okay.
And the dysphoria tends to go away in adolescence. If it does not, though, right, then if they're persistent, there's 3 terms: persistent, consistent, and insistent, that they are of the wrong gender, right, that they are the other gender, or that they are simply gender nonconforming, right?
Sure.
And so if we see, because it's like oftentimes people use that word phase, right? This is just a phase.
Mm-hmm.
When does it stop being a phase? And I think that's when it's, again, insistent, persistent, consistent, right? And because we know, if that child is demanding, right? And if these demands are not validated and listened to and given space to be able to explore, it can cause a lot of issues for that kiddo. If you're told you're wrong about what you think and you feel and about who you think you are, what does that do to anybody? But especially a little kid like that. So I talk with parents about, we call it the watchful waiting phase. So when they're young, right, a great thing to do. So there's Dr. Larsen-Odi at University of Iowa, who's a pediatric endocrinologist. Amazing person, and also works at the LGBTQ clinic at our River Landing, and Dr. Mboric and Dr. Nicely, wonderful people.
Those are the 2 I know. I wasn't familiar with the endocrinologist, but those 2 I knew.
Yes, yeah. And so one of the things that I talk with parents about is maybe we need to go and talk with an endocrinologist like Dr. Larsen-Odi, and there's hormone blockers, right? So a great thing that you can do for children who are struggling with gender dysphoria is start hormone blockers, which is completely reversible, right? It's essentially a way to just put a pause on their puberty, right? And if we start that young enough, and if the child does indeed continue into adolescence, saying, I want to be a boy, or I am a boy, I am a girl, right? This is what's right for me, and they're needing to transition, not wanting, right? They're needing to transition. Because that's what I see, right? And and the research backs that up. Like if we don't allow people to be true to who they are, what happens to anybody, no matter what it is, right? Like people don't thrive. And these children, it's life or death, you know? So often if they're not given the space to explore who they are, if they're not given the ability to transition, they become suicidal. The suicide rate for adolescents with gender dysphoria, it's like 50%.
Yeah.
Right? And if we have parental support, it goes down to 4%, right? And especially if we get them into therapy and just as a place to explore, right? And just to see, you know, to talk about like, how do you see yourself when you're an adult? Do you hope that you'll look more like mommy or more like daddy? And, you know, things like that, right? And just to be like, okay, all right, it's no big deal, right? And just who you are is who you are, and that's okay. But the hormone blockers, and one of the big things is, will insurance cover it, right? That's a big piece. But hopefully, if it will, that can lead to, because if the child does indeed continue having the dysphoria and desire to transition once they're into adolescence, you might be saving that child from so much distress when it comes to those secondary sex characteristics coming on in puberty. So, for example, if someone who is assigned female at birth, right, I'll say natal female, right, they start to develop gender dysphoria, and they, around 3-4 years old or even younger, they are demanding, I am a boy. When I grow up, I'll be a boy. When I grow up, I'll be a dad, right? We're seeing all these signs at very early young ages. And if into adolescence, they're still having these feelings, they're still feeling that way, well, oftentimes these kids, they know what's coming up with puberty, right? They've had those talks from their school or their parents. They've seen maybe an older sibling, or they know what mom or dad looks like, right? And so let's say for the natal female, right? That natal female is terrified of growing breasts, is terrified of getting their period. They don't want that, right? Well, what young girl does, but you know what I mean? Like I think about, you know, when I was young, okay, TMI, but when I was young, like, oh, I was like, what? This is going to happen monthly? This is the worst thing in the world. This is crap, right? Got handed a crap card. But I remember wanting to look like those older girls, you know, at the school, or, you know, wanting breasts, you know, and all of that. A natal female with gender dysphoria is terrified of that. And so if we start them on hormone blockers, then that development, again, just a pause button is put on there, and it could save them surgery later on. It could save them so much distress from having those secondary sex characteristics start on. And same for natal males, right? That they won't grow facial hair, they won't have, you know, putting the hormone blocker on could keep all those other secondary sex characteristics from beginning as well. So muscle development, things like that.
I would love to get
I could ramble on and on.
Well, no, I mean, there's so much here, and I would love to get either that endocrinologist or an endocrinologist on. I know that you is weird about having people talk to us, but because I think to a lot of people, the idea of giving kids hormones, because you hear about
not hormones, right, blockers.
Exactly, but this is the distinction I want to make sure that we're making, is crazy. The idea that you would give an 8-year-old or something, you would give him exogenous hormones just sounds nuts. The idea that you would do gender reassignment to somebody that was young it just sounds crazy, because, you know, little kids want to be animals, and little kids want to be all kinds of stuff. And so I haven't read the research, and I certainly don't claim to be an endocrinologist, which is why I'd love to hear from one, because I'm you know, the idea of blocking it and there's no sort of negative repercussions.
Right.
Again, I don't know that. I'm just thinking about, but if you were on them for years and years and years and then you stopped, would it take, because then if your peers had developed 3 years differently with extra testosterone or estrogen, are you really going to catch up? Like, what does that do to bone health? What does that do to reproductive capabilities? Like, I don't know the answer to that, but that's why I think it's an interesting conversation.
So far, the long-term research that exists shows that it's no sign. So it would be no different than someone who's technically a late bloomer, so to speak. Okay. So it kind of just speeds up to where it needs to be pretty quickly. But that's exactly why, I mean, we don't do any major medical intervention that is not reversible at a young age, because the dysphoria might go away. And they often, sometimes what happens is the dysphoria goes away and the children just grow up to be gay, right? But sometimes that doesn't. And so at that time, I think the biggest thing is we don't want to impose anything on that child because it can do more harm than good, right? Sure. And what I love about the blockers is it's just a pause button. It's nothing else, right? It doesn't do or not do anything per se, right? And then it gives that child space to be able to really explore what they want for the future.
I like the idea of persistence, consistence, insistence, because I think one of the problems that could potentially come up, and I would imagine there's at least one or two listeners thinking this, is especially from a young age, if you express that this is something you're thinking about, there might be, especially if you live in a left-wing family that's very loving and accepting, there might be this overwhelming outpouring of support that then positively reinforces this to then, if you tried to step out of it, what would that be like? Would you then, people then be mad? Whether they're going to think I'm lying to them? I would imagine that there would be people that would say, well, but then you're pigeonholing them in a way, and it being like, oh, because then do you switch back, and if so, do people take you seriously? Is that something that you've seen in the work you've done?
Well, I haven't seen that. However, I've seen more individuals who are just scared for their kid. They're just so. Parents will be just terrified of, what if we make the wrong choice for our child medically? What if this means, oftentimes it's, what will society do to my kid? Is my kid going to be safe?
Sure.
Are they going to be made fun of at school? When is the right time to allow them to change their name at school or to use that bathroom? What if they go into a bathroom? I mean, there's a lot of fears about bathrooms, right? Understandably, rightfully so. What if my child were to get beat up? And I think what I see is more because doctors won't even do anything. Physicians, I should say, won't even do anything other than the hormone blocker before the age of 15, 16, 17, right? Depending on the comfort level of that physician. Because again, we want to give them space and grace to be able to figure it out for themselves of what's going on. But I think my big thing would be, to any parent about anything, is we want to be cautious of our own bias because there could be a parent who loves soccer and is all about soccer and wants their kid to be all about soccer. And that kid might freaking hate soccer, right? If we force that kid to be in soccer and force them to do right because it's what we do in this family, we're a soccer family, kid's going to be miserable, right? And so it's kind of paying attention to your own bias as well about, because this could be like, oh, boys don't play with that, and girls don't play with this, and girls don't do that, girls do this. And okay, where is that coming from? And let's kind of give grace and space to the kiddo to figure that out for themselves. And
it also, though, could lilt into Munchausen's by proxy, because if your 6-year-old, if you decide, or they're deciding, or they're leaning towards it, they're saying, well, I'm the opposite gender, and you then tell everybody, and you then, the parent, get lots of support. I mean, there's that Munchausen's by proxy piece and we see it with kids that have all kinds of disorders, real or perceived, where the parents then become, well, my kid has Asperger's. And so, as you know, Asperger's went away several years ago, but it's but that was very much, a definition. People that get a false positive AIDS test or cancer, and then they don't have that, the studies have shown that they're more depressed when they find out that they don't have a life-threatening illness, because it became such a part of their identity. I like the idea of keep your mind open and explore, but I think that would be a tough line to walk, of supportive without pushing, like you say, into the we're a soccer family. So it's no, you said you're a little boy now. By God, we are left-wing, open-minded, super supportive. There is not a homophobic bone in our body. No. And so now everything is gonna be different pronoun. And then if the kid is like, well, I guess that's, I was kind of, as they get older, well, I was kind of, that was maybe a thing.
Right.
And, that would be one of the fears that I would have. And I think a lot of people, when they hear us say, because I have an almost 4-year-old, if you say, well, I heard a 3-year-old say this, therefore it's going to be that. That's, I think it gives a lot of people pause.
Well, yeah, and I can definitely understand that, right? I mean, because again, that's like imposing anything that's really important to you, but is it really important to your child? And I've never thought of it like the Munchausen's by proxy type avenue before, or heard of it in that way. But I can understand, like, there's that idea of, because the parents also want to talk about it with their friends. They want to get support, if their child is going through this. But there's that part of me too that also thinks you don't want to out your kid, and that's where I think family therapy is so beneficial to, like, let's all explore together how we're feeling about this, and let's explore with the kiddo what they're wanting, what the parents are wanting. Why are we wanting that? What's kind of underlying some of those feelings, and what are some of the motivations behind why we're doing what we're doing. And so I just think if your child is struggling with gender dysphoria, or if you yourself are, having a therapist on your treatment team can be so beneficial to just explore all those pieces. Because I could see that end of it. I often, what I have seen has been more of the opposite end of, no, we're just not going to talk about that, right? The more the right wing kind of maybe end of it is how we want to put it. But I think so much of that, again, it comes out of fear. Right. It comes out of, I don't get it. This means something is wrong, quote unquote, with my child. This means, this could mean, what is our community going to think about us? How are people going to judge us as parents?
Sure.
Oftentimes I see that end rather than the super left-wing hippy dippy kind of. No offense towards the hippies. No. I keep feeling I need to preface.
we love hippies here. So one of the things, and this is a pitch for anybody else who knows interesting people, is that I like to talk to people of all persuasions. I like to talk to intelligent people about interesting things, and I would always ask of guests that people be respectful to a degree, but I would love to hear sort of somebody else on the other side, because I think it feels to me like transgender is now what being gay was when I was in high school. So, I was involved in a lot of music and theater, and I had gay friends, and they came out and everybody said, oh no, it's a phase, you're trying to get attention, this is bullshit, and now it's much more accepted.
Yep.
Marriage is sort of not an issue for most people. It's now seen as being more extreme to not think gay marriage is okay, but now it's, but those transgender people, they're going to get attention, they're trying to, and then of course, like anything, the extreme examples come out. You'll see a picture of a guy who it's very obviously a meme, and it's like, you think that guy should be in the women's room, and it's like, yeah, but come on, I mean, you're using an extreme example on either side. The same thing could be
fear
said
tactics.
No, it is, and the same thing could be said about in Thailand, the concept of the Thai boy. The man, whatever, in Thailand where gender has been more fluid for generations, and so you see a picture and it's like, what do you think that is? Well, everything looks like a woman. Well, this is, so I think it's on the cutting edge of a lot of people's minds right now.